Antibiotics are medicines used to prevent and treat bacterial infections in humans and animals. From being miracle lifesavers, antibiotics are becoming ineffective or resistant to infectious diseases. New technologies need to be developed, but the frequent improper use of antibiotics too needs to be addressed.
And the doctor says take it for 4 or 5 days. At the end, they may still have like a little bit of it left. The next time they feel probably a sore throat, they have a sore throat or they feel something, they think, I'm having a flu, I need to take antibiotics, and they go back to their old ones. So all this improper use of antibiotics actually contributes to building resistance.
Taking antibiotics longer than prescribed can also lead to drug resistance, as antibiotics are left to circulate in the system, allowing infections or bacteria to adapt to them. Patients are therefore cautioned to stick to their prescribed doses, and that those who may not need antibiotics stop demanding for them. Taking antibiotics unnecessarily speeds up antibiotic resistance, making it more difficult and expensive to treat.
It's expensive in terms of the antibiotics. Also, it's expensive in terms of hospital duration because the people would be sicker. The routine antibiotics are not working. And for some of them, if they don't have antibiotics for those antimicrobial resistant infections, then it means it would cause death.
It is therefore vital to prevent antibiotic resistance in patients due to its dangerous threats of transmission to those who do not have the infection.
Strain that he or she passed on to you is already drug resistant, so your strain will be a similar strain, and you also be resistant to your infection will also be resistant to the existing antibiotics.
Critical steps which include close tracking of antibiotic resistant infections, regulating the appropriate use of quality medicines, and educating the public on the dangers of misuse of antibiotics is therefore paramount. Taking antibiotics unnecessarily speeds up antibiotic resistance, making it more difficult and expensive to treat.